Hi, my name is Terry Mamounas. I'm a breast surgical oncologist. I'm the director of the Comprehensive Breast Program at the Orlando Health Cancer Institute here in Orlando, Florida. So the question is whether core biopsies or FNA can replace sentinel lymph node biopsy in axillary staging. And the short answer is that they cannot. And the main reason that they cannot is core biopsies or FNAs have low sensitivity, particularly if there is minimal axillary lymph node involvement. And although, as I will elaborate, they don't seem to be able to replace sentinel lymph node biopsy in axillary surgery, they are useful actually in the management of the patients, as we will discuss. So for patients with normal appealing lymph nodes on imaging and by axillary ultrasound, core biopsy of the axilla or fine needle aspiration, we actually miss a considerable proportion of patients with minimal nodal involvement. And of course, sentinel lymph node biopsy is far more accurate in identifying axillary lymph node involvement in such patients because we can scrutinize the sentinel lymph node and do 2 millimeter sectioning and scrutinize the whole lymph node, often identifying micrometastasis or isolated tumor cells occasionally. On the other hand, as I said, core biopsy or FNA of axillary nodes that look suspicious on axillary ultrasound. This is a simple, minimally invasive procedure that establishes pathologic axillary involvement and then can facilitate clinical management of the patient if you know that up front. For example, if you then choose to perform surgery first, the sentinel lymph node biopsy can be avoided and you can proceed with the axillary lymph node dissection, knowing that the nodes are positive, and you can do that at the time of mastectomy or lumpectomy. Alternative, if the plan is to proceed with neoadjuvant chemotherapy, the biopsy lymph node that also has a radiopaque clip when we do the biopsy can be then targeted for future removal following neoadjuvant chemotherapy, along with the performance of the sentinel lymph node biopsy if the axillary nodes now have become clinically non-negative after neoadjuvant chemotherapy. And this approach is now, the term that we call it now is targeted axillary lymph node dissection. And actually, studies have shown that performing lymphatic mapping and sentinel lymph node biopsy, along with removing the clip node after neoadjuvant chemotherapy, they have resulted in a very low false negative rate, about 2 to 4%. So that has created a very useful approach for the management of the axilla. So although, as I said, ultrasound guided core biopsies or FNA are not able to replace sentinel lymph node biopsy, they're actually very useful in the management of the patient with early stage breast cancer.